conducting a series of dialogue and conversation with the public health experts in Southeast Asia and globally on various themes. I am your host, Piyusha Majumdar, and today we are going to do our conversation with Robert Terry in order to disseminate the WHO's global research agenda on knowledge translation and evidence informed policy making. Talking about Dr. Robert Terry, he's a manager of research policy TDR, the special program for research and training in tropical diseases at World Health Organization. Robert is responsible for priority setting, knowledge management, open access data sharing, and ensuring evidence is translated into policy and practice. He has worked extensively in the Middle East and undertaken development consultancy projects in several African and Asian countries for WHO, Oxfam, VSO, UNAIDS, and DFID. So, welcome to the show, Gary, and thank you so much for accepting our invitation. So, we would like to know what is knowledge translation and why is it critical in today's global research and policy landscape?
Yes, thanks, Piyusha, and thank you for having me on the podcast. I think there are a number of ways of describing knowledge translation, but essentially what we're talking about here is how do we take the evidence that is generated from research and use that to inform decision making and policy making. So it's that translation between the academic often evidence that exists and how that can then be used by others, sometimes non-experts, policy makers, decision makers, and others in ways that helps them inform policy improvement. And the idea being that evidence-based policy making is better. For particularly within the health for improving
Robert, since we're doing this podcast to disseminate our global research agenda, so we would like to know, can you just walk us through the global research agenda on knowledge translation?
Yeah.
And what motivated its creation?
Okay, I'm going to answer the second part first and then talk a little bit about it. So, as I said before, knowledge translation is, I think, essential in improving our decision making, our policy. And it is really important in today's world because in some sectors, in some countries even, we're seeing the use of evidence to inform policy. And certainly during the recent COVID-19 pandemic, we found there was lots of misinformation and wrong information available. And since the internet is now almost ubiquitous throughout the world, everybody has access to it, it's becoming increasingly difficult for people to navigate to sources of credible information that they can rely on and make informed choices. And I think that applies whether you're an individual, if you're a parent and interested in, whether you're vaccinated or not, or whether you're working within a health system and you're trying to make decisions about what's the best health interventions. So there are many approaches to knowledge translation. Often that revolves around taking the body of knowledge and aggregating that in some way and saying on balance, balancing the findings of the risks and the benefits. These would be the recommendations for how things should be implemented. Those approaches, I would say, they've almost grown organically over time. And there are lots of methodologies out there for evidence an output, a short brief, and how that then reaches the people that make policymakers, decision makers. Actually, an area that's been perhaps under research. So why do people make the decisions they make? What motivates them? And how can we present the evidence generated by quality research? How do we present it in ways that are understandable and, more importantly, usable, so that it has the impact that we can? So what we found over working in this area for many, many years is there is very limited research that actually underpins the actions that we take. So I described there, the creation of, say, a policy brief. So a shortened summary intended for an expert, but maybe somebody who's not an expert in to read, understand, and digest, and that it will present them with a number of options for taking things forward. The evidence underpins that approach is very sparse. So what we felt, and this piece of work was led by WHO, the evidence making group at WHO. What they felt was we needed an agenda, a research agenda, and actually help identify and then prioritize the different areas that we need to look at to see if we can improve the whole process of how knowledge is translated. So that's been done. It was quite an extensive process over a couple of years. We tried to engage as much as possible a representative group of experts from many different countries around the world. We looked at different types of expertise, whether they were policymakers or researchers, or whether they were representing. We had regional consultations, lots of online working, 3 rounds of Delphi studies. So these are studies where you actually outline a whole series of different research questions and then opinions on them against a set of weightings how important these would be forward, the cost of doing something, how long it would take to do it. And eventually what we ended up with is the global research agenda, which was launched earlier this year. So in just a very sort of brief summary, the agenda itself is divided into 3 broad themes. One looks at the intervention, so the sort of mechanisms of how knowledge is translated, and then another theme is around what are the barriers to that process and what are the facilitators and opportunities. And then the third one is really how do we measure all this? What are the methods? Do we need to have a framework to think about this? And what does the test look like? How do we even measure the impact of these different approaches? So we have those 3 themes, and then under those themes we have a set of research questions that have been set. So the first theme, which is on research interventions, so different approaches, there are 8 priority areas that we agreed on as part of this exercise. So that looks at things like institutionalization. So how do we create an institutionalized approach between predominantly, say, academic outputs and those that are in decision making? Or how do we perhaps embed that process? We look at things like engagement process. So if we want a representative view from a patient, what are the best methods of obtaining good quality representative information that isn't too biased or swung by individual opinions? We need to look at things like capacity, strength, how do we do very close to the TBR primary focus, which is how do we support the build-up of research working in this area. The second theme, as I said, was looking at the barriers and facilitating the opportunities to improve in this area. And under that theme, there are 6 priority areas that were identified. Again, the first one is how do you describe a particular situation? Do you have the right tools to understand the different stakeholders, the different needs, the drivers, who are supporters of perhaps change, who may well be those that are resisting change. And it's also how do we learn from the mechanisms that we're currently using? How do we collect and learn and change as we evolve and work? So, I mean, that's just a very brief sort of summary of what's there. And then the third theme was around the sort of methods, standards, measurements, theories, frameworks, just all the things that kind of shape the environment. And for that theme, there are five priority areas, and again, just providing a brief summary. We're looking at things like what is going to be the impact of artificial intelligence. Clearly, it will have an increasing role in the identification of data and the aggregation of knowledge and how it can be packaged. But is it done in a way that's helpful, useful? What are the biases within that system? Is it going to lead us down some false paths? And there may well be other types of knowledge translation ecologies, if I can use that phrase, in other areas outside of health that may well have learnings that we need to use and work with. So, as I said, we've got this global research agenda. It is out of necessity quite high level and very broad. But essentially what we're looking at is research on the interventions that are used by knowledge translation, what are the barriers and facilitators in knowledge translation, and how do we measure our output in knowledge translation so that it's actually having the impact that we want it to have. So that's all available. It's all on the WHO website. And I encourage anyone who has an interest in that area to search for that. I suspect there'll be a link somewhere on the podcast information that will.
Of course, we're providing the link as well. Very rightly said about the agenda. It's really interesting to know what is the agenda for the WHO.
Yeah.
What do you think, Rob? What are the challenges or what are the barriers that are still exist in translating research into policy and practice when we talk about low and middle income countries?
Yeah, I think, well, all of the challenges actually remain the same, whether we're in a high income country or low income country, I think. But obviously, the challenges will be ones that I suspect people can guess at, which is a lack of resources, often finance being one of them. But I think the key thing, and there is no lack of human resource, and so it's about building capacity and understanding. And perhaps the other challenge is around political will. So nothing really works as effectively if it's in a very negative political environment. So if there's a supportive environment, then I think we can move forward. And in some ways, in many countries that we work with, particularly in Asia and Sub-Saharan Africa, they're in a position where they don't actually have to repeat the mistakes that were perhaps made in Europe and North America. So they can come at this with a fresh eye. So this research agenda may well give them new opportunities to do things in ways, that are fresh, and use innovation, and they may well be able to adopt things like intelligence in a more open-minded way, perhaps. So, I think there are going to be barriers clearly around the capacity to undertake this research, but those are also opportunities in a way. I think things can be designed in fresh ways. Often what we see in medical settings is a leapfrogging tech, where new technologies like mobile phones have been adopted and used much more quickly with low resource settings, and many of these countries have never really put in place hardwired infrastructure for telephone, as an example. So I think there are some opportunities there.
It's really interesting to know how this global research agenda was developed. Were there any surprising insight or shift that emerged during the consultation or during research synthesis?
Yeah, this is always a good question. I mean, I've been involved with a lot of different types of research priority setting, and I, having done that for many years, I could almost say there will be three areas that will come out regardless of the topic. And that's around, how do we build capacity in this particular area? How do we fund in a particular area? And how do we ensure that whatever research is actually developed is then translated into policy? But there are always different flavors around that. I think something that came out quite strongly here was how we had to work quite hard to make sure that we had and heard voices from low and middle income countries. And that's often the case when you have these kind of global efforts. People who are very engaged in this come forward and their voices are heard. So we had to work quite hard to get a number of experts from low and middle income countries. And I think one of the things that's quite interesting, and I'm not sure how it's going to play out, is a demand for a sort of decolonization of the thinking in this space. So, as I said, what perhaps was a very long established democracy in, say, Europe may well not be the way to operate in the Western African scenario, or in a francophone country, which may have a cultural approach to how things are communicated. I mean, I wouldn't say I was surprised by that, but this was quite a strong flavour that came out, from this. And also, I think what was a surprise was how little evidence there are underpinning the activity. When we consider what's a group is the best way to present evidence so that it can inform research that actually supports the mechanism we use is very thin. That was actually quite a surprise, and I really look forward to seeing how people have the opportunity to really think about this, sort of disentangle. What is it that will work in different situations? Without making too much of a case. We are seeing in some well-established democracies, like say the United States, quite a challenging environment for what we would consider to be, a fairly straightforward presentation of evidence. And so why, in those environments now we're seeing, well, that's being questioned, working. So there has to be a change in the dynamic to work out, again, if we're looking at the vaccine hesitancy, what is it that is really underpinning people's concerns? How do we listen to what they're saying and provide the information that we think is necessary in ways that everybody can benefit from? So that's going to be kind of a challenge, because I think previously we would have only thought, well, we do the evidence, we have a result, that's the correct answer, regardless of anyone's values and beliefs. We just try and push it. And I think what we're seeing is that approach actually may not be the best approach and may not work in some instances. So that's going to be an interesting development, I think. How do we work with that dynamic? It's always easy to speak like-minded people, this kind of echo chamber approach, and it's much harder than work with people who are not easily convinced or accepting of what you're saying, and so we need different ways and approaches and methods.
Right. So, Robert, what inspired you personally to work in the area of knowledge translation? And can you tell us one small step you're taking to support knowledge translation in the research field?
Yeah, so I mean, I work for TDR now, which is very much focused on health. But in actual fact, my background many years ago was in agricultural development. And it is interesting, we now hear about One Health approaches, and in actual fact, I'm quite well able to engage with that because I've worked in the agricultural sector, I've worked now working in health for a long time. And what I do see is that to actually create knowledge, evidence, and then not to work to make sure that it's first of all disseminated in the proper way and then available to be used. To me, it seems like we're really, really missing a trick. So forever, it seems, I've been an advocate for open access publishing, and excuse me, my main driver for that basically was for the vast majority of academic research. It's essentially funded out of the and those that have funded it and those that aren't particularly affected by the outcomes cannot read it because for years subscription basis. So first step is let's democratize the outputs of science. So make sure people read it. It's also good for science because it makes it more transparent and open. And therefore, what I really see is as we've got better, I think, at presenting the case and putting it in context. A lot of, certainly 10, 15 years ago, it would have been evidence-based decision-making. You just take the evidence and we're supposed to make a decision. Now, it's much more accepting that we're talking about evidence-informed decision-making and really understanding some of the pragmatic things that like money and effectiveness, but also things like values and beliefs. So this is an interesting example that came to light from the pandemic, where there was a lot of time and energy and a lot of review of different types of research looking at whether there was a value to putting face masks on children under 5. In fact, the evidence base itself was very mixed, but also on reflection, the stress felt within parents and perhaps the harm that may well have been done to young children about the parents probably based on young children are not going to have any real benefit in that particular situation. So it was a good example of having to balance not just research, but also values and beliefs, and how it actually affects people. And I think that is an extremely important part of the whole human process here, because it's never just we're not just automatons. We have these beliefs, we have our own feelings and thoughts, and really, how do we bring in and balance those? Again, I think that's going to be a very interesting area to research. Think about more individualizing policy as opposed to public health is often about let's serve the majority as best we can. So how do we also then think about of outcomes?
Okay, so this would be my last question for you, Rob.
Okay.
Now we know that how artificial intelligence has captured all the spaces. What do you think about the future of knowledge translation in presence of artificial intelligence? What do you think how it's going to work for knowledge translation?
Yeah, well, I mean, I can have an opinion. I wouldn't say I would know any better than anyone else. The first thing I would say is that artificial intelligence, the first thing is it's artificial. So in actual fact, it's only as good as the evidence, knowledge, text, books, whatever that it can access. And so again, I go back to my previous campaign that's been running throughout my whole professional career about creating open access materials. So if we have high quality open access materials, then artificial intelligence has access to that. And that means the job that it can do with respect to the aggregation and the representation of that evidence can only be a good thing and can only get better. I don't think it's quite there yet, but it's getting better at such an extremely rapid rate that I think we can start to see very good things. And I'm sure everyone is now familiar. When you search into a search engine, you often get a summarized policy brief at the beginning rather than a whole list thereafter. So that's important, because that will actually, for some people, that will be enough. And therefore, what we need to be careful is that those artificial intelligence agents are accessing the correct material, and to make this choice and decision between what is quality evidence and what may be suspect evidence, or maybe just opinion based, or doesn't have an underlying say data set. I think that's going to be a challenge, and so there may well be roles for more reliable, curated artificial intelligence mechanisms. And I think that's certainly something that WHO is very keen to help out, because when you get artificial intelligence together, you can trust the sources of information, credible and reliable. But we're already seeing in other areas of health where it's having a massive effect. So if we think about, say, breast cancer and screening for prostate, a human doctor may, in the course of a lifetime, get to know, and make this up now, maybe 20,000 images in their whole lifetime, and they use that very well to try and make assessments on breast cancer. Whereas an artificial intelligence tool learn from not just hundreds of thousands, but millions of them. And we're already seeing that some of the better diagnostic tools there they've increased their some now well over 80% ability to spot badly than, and we're actually seeing that play out throughout health. Those, I think, are good developments, and I think we will see similar things in how knowledge is translated by artificial intelligence as we go forward. So essentially, AI essentially will be one of the main tools. Things it can't do so well, certainly yet, is AI is not able to imagine what isn't there. So the human brain is very, very good at identifying, we have this set of knowledge here, therefore the question that we actually to fill in this knowledge gap is like this. So that's the kind of creative side of things. And I'm less convinced at the moment that AI cannot do that. So it can tell you what exists, aggregate what's there, repackage it, and spot things that are in enormous data sets. But what it's not able to do yet is, identify what are the gaps, how do what's the next step, how do I imagine what the future should be, that's still an area to develop. But right now, I'm grateful even in that time. I'm sure it will change. It may well change again.
Definitely. And thank you so much, Robert, for coming to our show and telling our audience about this global research agenda of knowledge translation. And I truly appreciate your passion for doing KT
Thank you.
in the field of research. Thank
I
you
just
so
realized,
much.
Prayusha, I should have said, and if you don't mind, I'm just going to say, so people will often say, great, we have a new agenda, so what? Well, I mean, TDR, we are a research funding agency, and we have a call. I mean, this is being recorded towards the end of June 2025. So we have a call out now where we're looking to support researchers based and working in low and middle income countries to take forward some of the research priorities that we've outlined in the global research agenda. So I'm really looking forward to seeing what kind of projects come through and how we assess those and taking that forward. And that's, very much to our mission. And it goes back to one of your earlier questions about building capacity. That's, so in a small way, that's our contribution to that. What has been quite amazing for me is we put out one of the courses we've got onto our LinkedIn page. We had over 40,000 impressions on that page. So
Wow.
that tells me two things. One, there's probably not enough research funding out there at the moment, but also there's a huge interest in this area. So that's extremely encouraging, and it'll be beholden on us, I suppose, to pick some of the best projects out of that massive interest and really see if we can move this forward in a productive way. So apologies.
Yeah, perfect,
You at the
perfect.
end.
Thank you so much, Rob, for at least telling us about this, this grant or the call for application. And I will definitely be sharing this information, your call, and also the podcast with the people who are working in the field of implementation research. Thank you so much.
Thanks, Piyush.